The next part of the inspection of the eyes includes a visual inspection on my part. Jason, I'm just going to take a look at your eyes. I'm going to place my hands on your face. First, it's important to look at the eyes, look at their symmetry, including the eyelids, the sclera, the iris, and the size of the pupils, noting their size and noting any discrepancies between the two sides. Next, I'm just going to put my hands up here, placing the fingers above, holding the eyes open like this. If you could look down for me. Good. Excellent. Okay, relax. And then holding the eyelids down, if you could look up for me. Noting any kind of deformities in the sclera or the conjunctiva if you can. Sometimes the sclera will be icteric, meaning yellow. They can be injected. These are all signs of diseases that can be followed up further. Alright, this is the visual inspection of the eyes. Next, the patient's eye exam includes an examination by confrontation. This means that I'm going to be checking the different visual fields of the patient. We break up the individual eye visual fields into 4 quadrants. And we do this by asking the patient to close one eye. Jason, if you could just close your right eye. And then with your left eye, just look at my left ear right here. Okay? And what I'm going to have you do is I'm going to move my finger, and if you see it moving, you say yes. Okay?
Okay.
You see this finger moving?
Yes.
This finger moving?
No. Yes.
This finger moving?
Yes.
And over here.
Yes.
Checking all 4 quadrants of his visual field, including the nasal field and the temporal field. Now we do this with the other side as well. If you can just close your left eye, or you can hold a hand over it, we can test the same way. Do you see the finger moving here?
Yes. 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 Yes.
You have the patient always looking right at my ear, okay? And this way we can see if there's any deficits, for example, a hemianopsia in the visual field. Again, this is called visualization testing by confrontation. Alright, the next part of the visual examination includes pupillary response to light and convergence. Alright, this is done by placing a light from the ophthalmoscope into the eye while the patient is fixated on a finger, checking both direct and consensual reaction to the light with the pupils. Alright, Jason, I'm just going to have you look here, and I'm going to shine a light in your eyes, okay? And we first always want to make sure that the room is dim. So if we could just have the lights turned off, and checking this side, we have a reaction there. And checking this side again, I look at the other eye and we check consensual reaction. That is a response on this side with light in the contralateral side. Alright, Jason, just keep fixated on my finger here. I'm going to check this side, looking at this eye first. Good, pupillary reaction. Now looking at the other side for consensual reaction. Good. And if we could turn the lights back on. Next, we're going to check for convergence, and this is done by placing the finger in front of the patient, having him fixated on it. Just keep your eyes on my finger and moving it in towards the patient, making sure that the eyes follow it and come together. Good. Excellent. This concludes the part for assessment of pupillary reactivity, both direct and consensual, as well as convergence. The next part of the visual examination includes an assessment. Part of the visual examination involves examination of the extraocular muscles, and in so doing we're also testing cranial nerves 3, 4, and 6, the oculomotor, the trochlear, and the abducens. Alright, this examination is performed as such. Jason, if you could just keep your head still and look at my finger. I'm going to be moving my finger back and forth while watching his eyes to make sure that they follow it and correspond with one another. Alright, you start off in the center like this, just follow my eyes, keeping your head still again. Moving the finger in an H pattern, noticing any discrepancy in the eyes or any nystagmus. Coming back to center. Then, in diagonal motions, testing the eyes, noticing any discrepancies, hesitations, or deficits. This concludes the examination of the extraocular muscles.